Hello, everyone. It's my great honor to have this opportunity to introduce application of phototherapy in psoriasis treatment in China. I'm Yuling Shi from Shanghai Skin Disease Hospital, Institute of Psoriasis, Tongji University School of Medicine. I will give the talk from the position of phototherapy, mechanism of phototherapy, efficacy, and adverse events, and combination therapy and bright future. So, as we know, phototherapy play a very important role in the treatment of psoriasis. So, in clinic, we usually use a different phototherapy treatment, include narrowband UVB, UVA1, PUA, and 308 nanometer UV, and broad band UVB, and the combination, and also we also use the home phototherapy. So there are a lot of options for phototherapy. And between 1990 to 2017, the rapid pace of social development in China led to the world is eye-catching. So, and the prevalence and incidence rate of psoriasis have also increased significantly. And also we know the advantage of phototherapy in treatment of psoriasis is a lot, include cost effectiveness, high efficacy, versatility, and non-invasive and painless. And also it will cause the long-term remission and safety profile, and it's a very good treatment option. So there are a lot of advantages of phototherapy in treatment of psoriasis. Even though now is the age of biologics, still in China, phototherapy have a very important position in the treatment of psoriasis. So phototherapy play is very important effects and therapeutic effects in psoriasis through immunosuppression, DNA damage-induced apoptosis, anti-inflammatory effects, and modulation of immune cell function, and also regulation of skin cell proliferation and differentiation, and the specific mechanism associated with different type of phototherapy. So I think this mechanism contribute to the reduction of psoriasis inflammation, improve skin cell turnover, and symptomatic relief for patients with psoriasis. So its efficacy of narrowband UVB, it's very good efficacy in treatment of psoriasis. Regardless of the different type. So this is randomized placebo-controlled trial secukinumab versus narrowband UVB. It's very new paper, and the primary endpoint was achieved. 99.1% of patients achieved a PASI 90 response at week 52 in the secukinumab versus 42.3 percentage of patients in the NBUAB. And the international guideline for diagnosis of treatment of psoriasis. So phototherapy is the first line in treatment of psoriasis from the S3 guideline and a French guideline. So we can see phototherapy is first line. And according to the guideline for diagnosis and treatment of psoriasis in China, phototherapy is recommended to treatment of moderate to severe plaque psoriasis. And the long-term safety analysis of therapy, we know the long-term UVB phototherapy can lead to photoaging and premature skin aging, and the carcinogenic effects of UVB are controversial. with narrowband UVB having a lower carcinogenic potential compared to broad spectrum UVB. So the carcinogenic effects of oral PUA are well established, with the increased risk of skin cancer such as the SCC and BCC. Additionally, PUA may cause skin discoloration disorders. And for the short-term safety analysis of phototherapy include erythema, itching, blistering, and exorsis, and hyperpigmentation, and photoaging. So as we see, the risk of skin malignancy is significantly increased with PUA, and limited data are available for narrowband UVB. So for oral PUA, nausea and abdomen pain may be also occur. So for the subspecial population, such as the HIV, mild to moderate psoriasis with HIV infected patients, so phototherapy is a very good choice, and there are a lot of advantage. Also for the another special population, such as the patients wishing to become pregnant or pregnancy and breastfeeding, phototherapy is a very good choice. And the other special populations, such as the malignancy, including the lymphoma and skin cancer, phototherapy is still a very good choice. So the study need to explore and optimize the low-dose UVB for long-term maintenance. So the prospective studies on efficacy and safety of long-term low-dose UVB phototherapy is required. So how to improve the efficacy of phototherapy? Combination therapy is a very good option. For traditional treatment option, isotretinoin or methotrexate, combined with phototherapy is a very good choice. And still for biologics, different target biologics with phototherapy still need more data to the established the rule. And for the study on the population of China, we carry out a study about narrowband UVB treatment study in the patients of psoriasis. We did a comparison of different incremental dose regimen of narrowband UVB in skin type 3 to 4. A prospective randomized single-blind parallel study in patients with psoriasis. We found 20% dose increment has a good safety and higher patient response rate than 10% dose increment. So our study aim is to compare the efficacy and safety of 3 incremental doses regimen of EMB-UVB, 10% to 20% and 30%. And for the just now I mentioned for the skin type 3 to 5. So 111 patients were enrolled. 50 patients received 10% dose increment, 50 patients received 20% dose, and 11 patients received 30%. Because 30% is a very high adverse events, so in the middle of this study, we stopped enrollment to 30% this group. And as just I mentioned, so we think a 20% incremental dose regimen results in a faster response for psoriasis without increased risk of adverse events in 3 to 5 skin disease, 5 types. And we put this, the recommendation here to Chinese guideline. So here mentioned the Professor Shi established a new strategies for phototherapy of psoriasis in Chinese population, proposing Chinese data and plans of phototherapy. And we established a phototherapy center. So list for the pictures for the patients who carry out the phototherapy treatment. after 12 weeks, a very good response. That's the other patients. So also we usually use home phototherapy. It's a very good choice for patients because the home-based phototherapy is very convenient and cost-effective. Is very good, and it have the privacy and good treatment compliance. So finally, I will give you a summary. Phototherapy is a very good, cost-effective, and effectiveness treatment method for psoriasis, with superior efficacy in treating moderate to severe plaque psoriasis and relevant few systemic adverse reaction. And family phototherapy has great prospects for long-term treatment of psoriasis. Thank you for your attention. Thanks.